Timeless 106.1 FM KFFB. This is Bob McConnell at the news desk, and we are just taking a moment. We do have authority on the coronavirus with us, Dr. Kendrick with the Conway Regional Hospital. And Dr. Kendrick, thanks for taking time and educating all of us here with Timeless 106.1 KFFB.
Yes, absolutely. I'm happy to be here. Our hospitalist group rotates up here at Ozark Health in Clinton as well, so we're familiar with this area for sure.
Well, one thing we need to talk about a little bit is with Conway Regional, you guys are also testing for the coronavirus. There's two hospitals in our listening area, the Conway Regional, also Baptist Health in Heber Springs. They have to call ahead there because there were some cases, but you're basically taking doctor referrals. Is that correct?
Yes. At this point, we have a testing center set up where we can do that efficiently with a drive-through method where we protect patients from exposure unnecessarily and we protect our staff from exposure unnecessarily as well. But it is set up such that, just like any other lab test, at this point, you would need a physician's order to be able to get that sampling done.
What is that like for someone that may think they have it? Shouldn't they be tested for the flu and other things before they clog up the system for coronavirus?
Right. Most certainly there are certain, the usual suspects are still at large. And so the flu is a big one. It is a process and something of a procedure. So what I would tell you is that if you feel like you need to be considered for that, we have had patients going through their primary care physician's office, and those primary care offices understand what are the risk factors, what are the symptoms that would warrant someone being tested, and we have let them make a decision on whether or not they want someone to be sent for testing. And so we call that question process screening, not to be confused with testing. So screening is just kind of having a conversation with the primary care provider's office about what symptoms you have, what risk factors you have, and whether or not you do fit the criteria to go and be tested. And by the way, those criteria are changing on a daily basis over the past week, at least, since there have been more and more cases. But we do test for flu frequently when those patients come through the drive-through, and we also have been checking for the coronavirus as well.
Now, what does a person can do now when the governor basically told school children to take an extended spring break, which is great, really, if you look at the positive side. They get to have some free time, recuperate a little bit of family time. But what's some of the steps we need to do to protect ourselves?
Well, I think the messaging that has been fairly universal at this point holds true, and it seems simple, but separating yourself from the general population is generally a good move. I think for sure trying to stay at home, unless you really do need to go get something done, is an important thing. I think hand washing frequently is important. This virus can be transmitted by droplet, which means that if you are around someone who's coughing or sneezing and they have it and you walk through their sneeze cloud, then you are at risk for getting it that way. But you can also obtain the virus from touching objects that have virus on them. And then, as we all do, you touch your face or your mouth, your eyes, and you are at risk for infection that way. So hand washing is a huge thing. And I am all for hand washing with soap and water, and I'm all for hand washing with hand sanitizer. Both methods are reasonable and work. The only other thing I was going to say is that the words that everyone keeps using, social distancing, I think is important. I think the 6-foot perimeter is a good idea, so try to stay 6 feet. If you do go somewhere, just try to stay 6 feet away. You can still have a cordial conversation with somebody and not be rude, but not be right up next to them, and try to limit numbers of people that are gathered in one area together.
One thing I've noticed, how much cleaner we are as a society.
Right. No, I agree completely. And I think that our attention has been grabbed, and I think that we are all paying much more attention to that. And I think that has implications for next year's flu season, for instance. We should be doing that during flu season anyway.
And when does a person really need to be concerned with some of these symptoms? Because, I've even seen where the president was kind of arguing with the press a little bit, saying that his doctor was saying he didn't have these symptoms, don't get tested, because he felt like the test should be for those that are sick. And there is a fine line there, so you could be allergies. So when should we take that extra step?
I think this is an important question because a lot of patients, the majority of patients who do end up contracting this illness will have mild or maybe moderate symptoms. 80% plus of the patients that get sick with this do not get severely sick. So What do? I would say the same thing that you do with a cold. If you have mild symptoms and you are not feeling toxic, but you can still go about your business around the house and you can still eat and drink and you're not having trouble breathing, then you probably should stay home and take care of yourself at home and isolate yourself from anyone that you could possibly give the infection to. But if you do have symptoms where you feel things are not right and you are short of breath, or if you are having confusion, or if you are not able to stay hydrated, then that is when you would need to seek medical care. And that would be an appropriate time to present to the emergency department. Along that line, too, because we want to reduce the transmission risk, we have asked that patients please call either their primary care office or the ER, depending on which place you're going, before you go so that they can make preparations to receive you in a safe manner.
Well, Dr. Kendrick, thanks for taking time and giving us an update of what we need to do. Dr. Kendrick's with Conway
Yes.
Regional Hospital.
Thank you. Glad to help.
Thanks so much for joining us for another edition of KFFB's Open Mic program. We'll have this on our YouTube and also KFFB.com. Also like to remind everybody that for Cleveland County residents, if you think you've been exposed to the coronavirus and are exhibiting some symptoms, Baptist Health Heber Springs has established new drive-through hours. They are open Monday through Friday from 9 to 3 and Saturday 9 to noon. If you'd like to be part of this screening, you must call ahead to make an appointment. The number is 501-887-3279. Please do not go by the drive-through testing center without an appointment. Thanks for joining us for Open Mic.